Lutheran Garden, and she is an in-person assistant with Enroll Virginia. So she'll be talking a bit about the Affordable Care Act. While she gets set up, I will pick.
Everyone, I'm so glad to be here, and thank you, Kendall, for inviting me. Kendall and our paths crossed on a hot summer day. We were at the Hispanic Festival, and she was sitting under a tent, and I was sitting under 90-degree weather. She did not invite me to come sit under a tent, but that's okay. I'm glad you invited me today, so I'm glad to be here. So I wanted to talk briefly about health care coverage and health care insurance. And it sounds as though I'm in good company. Many persons here are already familiar with the topic, Affordable Care Act, Medicaid gap, etc. So I'm quite sure I can condense this somewhat. I am an IPA, in-person assistant. So my role is to go throughout Richmond and Falls Church up in Northern Virginia to promote affordable health care coverage, health care insurance. I sign persons up for enrollment. So they come to me, they're looking for health care coverage, I sign them up. And also I go about teaching, doing educational outreach into the community, letting people know the importance in having health care insurance. You would be surprised how many people still are uninsured and still not educated about the importance for preventive maintenance, for their livelihood, for their health. So that's my job. And I work for Enroll Virginia. Anyone ever heard of Enroll Virginia before? Well, they're a nonprofit. They're under the umbrella of Enroll America. And we are busy bees. We are scouring the entire state from Wise to Southside to Nova, providing outreach and enrolling persons. We are navigators. We are in-person assisters. We are certified counselors. So we're here to make sure that more people get signed up. And how do we sign them up? Particularly through the ACA, the Affordable Care Act, Medicaid, and other resources. Okay, so to tell you a little bit about the ACA, or actually who here is familiar with the ACA, Affordable Care Act, okay, also known as Obamacare, all right? So the ACA is here to stay, 5 years plus. Just recently with the King versus Burrell Supreme Court decision, it's been solidified. People have their tax credits and it's here. So many people who come to me to sign up, oh, I want health insurance, I need help, you know, I haven't had health insurance for years, I'm sick and tired of going to the clinic, waiting in the long lines, I haven't had myself checked out. One young lady came to me and said, I just want to feel clean from head to toe, I just want to get checked. I want it, I like our president, it says that I must have health insurance, it's the law, it's the mandate, can you help me? Yes, I can help you, let's talk. But I know in the back of my mind, let's really talk. Because many people who come to me, they say, I want it, I need it, I have to have it. I want to get, you know, a sleep disorder checked out or asthma disorder checked out or whatever ailment. And I said, sure. And I said, but do you know that it is income-based and income-driven? Well, what do you mean? Well, let's meet. We'll bring your W-2 forms, bring any statements that talks about your income. So the ACA works according to the federal poverty guidelines. And I know that was mentioned once or twice before. We'll get it there. Quite. It's sleeping.
Okay, we will get it. We will get it.
So it works according in conjunction with the FPL, Federal Poverty Guidelines. And the Federal Poverty Guidelines were kind of instituted, or its beginnings going back to the 1960s under President Johnson, which they needed a criteria, definition of what is poor. And they needed to know what is the minimum that we need to eat, travel, live, just the minimum. And they came up with these guidelines. But you know what? I don't think they took health care insurance into, but you know what? I got Plan B. Don't you even worry your pretty head. So if you can pass this around. You can pass this. What's coming to you is one of my handouts, but if you flip it over on the backhand side, if you flip it over, at the very top, they got it right in front of you, Sarah.
Okay.
You got the federal poverty guidelines right in front of you. Is everyone able to see that?
Yeah.
So people come to me and say, oh, I need it. I said, well, let's talk. Let's talk. So how the ACA works, the Affordable Care Act works is, hey, hey, yeah, you need to sign up. Anyone can sign up. Well, you have to be a U.S. citizen, live in the United States, and not be incarcerated. Those are the 3 criteria. And illegal immigrants, they're excluded. But how it works is, did you get a sheet for us, Sarah?
I can look at this.
How it works is it's income-based. If you're looking for an affordable plan, what does affordable mean? A discounted plan where you're not spending $500 a month or more, right? So if you look at the federal poverty guidelines percentages from 100% to 400, those are the persons whose income falls into that for the annual salary can get a discount, which is called the tax credits. Okay, you get a lesser amount. However, if you look between that 100% and 200%, those are the persons who can get a really good deal. They can get the cost sharing reductions or just a lower cost. So really quickly, since I have less than 3 minutes, if I get a person coming in, I just got a lady come in, one person, she earns about $16,000 a year as a housekeeper. I said, what? Great. We found a nice Coventry plan, $16 a month, wow. 0 deductible, and that includes dental. When we say it again, $16 a month, 0 deductible, and that includes dental. Why? She fell between that 100% and 400%. A single woman, she has 2 kids, they're under Medicaid. Well, her salary was $16,000, which falls between the 133% and 150%. Everyone sees that? Yeah. You follow me? All right. Got a gentleman who came in. It's just him, a single man, grown child. He earns $48,000 a year. Where does the $48,000 fall? He's one person. It's beyond the 400%, right? Mm-hmm. He's not entitled to any discounts, any tax credits. So when we look for plans online, the cheapest plan was around $375. He said, no way. I'm not going to pay that per month because that's the premium that you have to pay per month. Sick or not sick, doctor or no doctor. You still, like, we got to pay car insurance each month, accident or no accident, you have to pay. So he said, no, I'll just take a tax penalty hit when it comes to taxes, and I'll pay that one-time fee, which is $375, rather than paying out each month $375, sick or no sick. You got it so far? Mm-hmm. You with me? Then let's talk about the persons who's below the 100%. The persons who are below 100%. I had another handout.
You need one?
No. Just looking for my notes. Oh, here it is. Right behind me. Sorry, guys. That's okay. Coming to the wire. Pass around. The persons who fall below the 100%. These are the bulk of the persons who come and visit me. These are people between the ages of 18 and 54, mostly hardworking persons, working low-wages jobs, a Rite Aid clerk, a CVS clerk, a housekeeping person, a cook at the your typical restaurants. These are people coming to me, and they make on an average $600 to $900 a month. Wow. Okay. $600, $900 a month times 12 is about $7,000 to $8,000. That's less than that 100%. They fall in, and this is the whole point of my talk, and I'm wrapping up, the Medicaid gap, which was talked about earlier, the dreaded fall into that gap, the bottomless pit. These are people, hardworking people. What do you mean? Just because I only earn $700 a month, I'm not entitled to a good paid $16 a month premium plan on the ACA. What do you mean? Just because I didn't go back to school, that at this time in my life, these are the only skills I have and the only job I can get. I'm doing the best I can. These are the stories I hear all the time. Grown men and women coming to my office looking for health care coverage, but if they're earning less than that 100%, tears well up in their eyes and they say, so what can I do? What can I do? And you know what I say to them? You can still get insurance. Sure. You can still do it through the ACA, Obamacare, if you want to call it that. But you're going to get plans that's going to cost you around $100, $200 a month. Shoot. And not that $16, $20, or $40 a month. Because they don't qualify for tax credits because of the income. Very important, and I'm closing. The Medicaid gap, as was stated earlier by some audience participants, it's an ugly thing. And the inequity is people who are hardworking people, average jobs, cannot get affordable health care coverage because of their income, because of where they are in this particular stage of their lives. So what can you do? Couple of things. Get on out there and write your editors. Get on out there, share your stories. Places like Enroll Virginia, Planned Parenthood, the Consumer Voices for Healthcare Association, we collect stories. So when it comes time for General Assembly in January, we say, hey, we got some real people here who need some real insurance. And here they are being stigmatized and ostracized because of their income. They cannot, so here's a double-edged sword. They make only $900 a month, but you can't get affordable health care coverage. They can't afford to pay that.
So they make too much for Medicaid, right?
They make, thank you, they fall in the gap. They make too much for Medicaid. So these are your, it's a lot. It's a lot of folks. It's about approximately 286,000 folks throughout the state. Yeah, it's not a couple of thousand, it's a couple of 100,000.
So if we expanded Medicaid, would that cover the gap?
Medicaid would shoot up the Affordable Care Act, the Obamacare, to 138%. So with their incomes, they can then opt into the ACA and get affordable plans. If it expands it, and she's right, if it expands it, but they have voted, and our governor is upset, they have voted against it during the last.
They were thinking about having a special session for that even.
There's been talks.
And it's very political, like the gentleman said earlier, because our governor's for it, but a lot of the Republicans are against it.
And a few states just recently opted. Alaska's about to sign into the Medicaid gap, and Montana just signed. Very quickly, and I'm done. What will happen if we have the Medicaid gap? 800,000 more mammograms, 30,000 more jobs, 500,000 more physician visits. So it's more a reduction in 30,000 people who won't have to borrow money just to pay their medical bills. It's a needed thing. Reach out, talk to your legislators. Thank you.
Any last questions?